The following is brought to you by Vertical Vet. Rethink your GPO.
Hello, Vertical Vet family. I am Dr. Ernie Ward, Chief Veterinary Officer for Vertical Vet, and I am super excited about this edition of Veterinary Medical School. And this week, it's brought to you by one of our favorite folks in the whole wide world, Antech, and it's all about the latest in technology using, of course, our favorite friend, artificial intelligence, but it's going to help us today with dentistry and dental imaging, which is something that, if you've been in practice as long as I have, it's always a bit of a mystery. There can be a lot of sort of vagueness and ambiguity to some of those dental x-rays. And today we have got a wonderful expert to help us understand it all and how we can use AI in veterinary dentistry. This today is all about Antech RapidRead Dental. And our guest today is Dr. Criss Herrera. She is a veterinarian based in California, and she currently leads the Antech Imaging Services. Her focus, though, is on advancing AI-driven tools like RapidRead. She graduated all the way from University Cardinal Herrera, CEU in Valencia, Spain, and then, of course, she went to practice and did all kind of referral work around the UK, and then joined the Antech team. With her clinical interest in surgery, oncology, and radiology, Criss brings a practical, patient-centered perspective to innovation in veterinary medicine, helping us veterinarians improve our efficiencies, confidence, and patient care through cutting-edge imaging technology and artificial intelligence. Dr. Herrera, thank you so much for joining us today on Vertical Vet Med School.
Thank you, Dr. Ward, for the kind introduction. I'm very excited to be here today.
Well, we love talking about artificial intelligence, but more importantly, here at Vertical Vet, we are looking for ways to help elevate practices and help them actually do a better job with patient care. So I guess before we get started with how amazing Antech RapidRead Dental is, just maybe set the table. What are we talking about today when it comes to artificial intelligence and imaging? Kind of just give us that, 30-second elevator pitch.
Yeah, sure. So today we're going to be talking about artificial intelligence, specifically related to dentistry. And, dentistry is one of the most common procedures that we perform in veterinary medicine, right? And it's also one of the areas where, disease can really be underestimated. So I think AI products like RapidRead Dental are, a really, really great tool for veterinarians.
Yeah, and I love that. I mean, it's that simple. It's really helping us in an area that's very complicated. And, guys, look, I've been a veterinarian now for 35 years or so. And, Dr. Herrera, in my day, dental x-rays were a luxury. Today, they're kind of standard of care. And I think that we're still, though, a bit perplexed sometimes at trying to figure out exactly what we're looking at when it comes to those x-rays. So I want to start off today's discussion with, okay, you're immersed in this. Antech leads the industry when it comes to applying artificial intelligence to diagnostics and imaging. But what problems are we really solving here for the average general practitioner? I mean, so how can AI actually help us do a better job with dentistry?
Yeah, so we actually developed RapidRead Dental to really bridge the gap between wanting a second opinion but not having a veterinary dentist available, right? So really at a high level, RapidRead Dental is an AI-powered tool using deep learning that analyzes full dental radiographs contextually and gives you a tooth-by-tooth assessment within about 10 minutes. So it's really, and I have a slide that maybe we can pull up, but we really to really understand the how powerful dental RapidRead is. I would like to maybe go to the next slide here. One second. There we go. Just to kind of talk about the terminology here, because I think it's important to understand. So AI is really thrown a lot out there, and it just really means that there is a computer that simulates human learning, right? So machine learning is within AI, and it makes predictions based on data, and it follows rules and patterns. And within machine learning, there is a subset that is called deep learning. And this is very important to understand because this is how we develop the product. It uses a series of layer neural networks to learn very, very complex patterns from data. And it learns the rules on its own. It really excels at pattern recognition, which is important for radiographs. And there's the latest and greatest with the technological advancements in deep learning called transformers. And this looks at the full image context. But if we don't, I think I don't know why this is going. Hang on, something's going on with my slides here. Sorry, just give me 1 second here.
Oh, no. And while you're kind of fixing that, because obviously, slides can always do weird stuff. But, I think it's really important for vets to understand that, artificial intelligence and, large language models are not created equally. And that's one of the reasons why I really stress to veterinarians out there who are sort of dipping their toe, evaluating what's available. You really need to go to a group, a company, somebody that you trust that has really built it based on veterinary data. I mean, Dr. Herrera, there are so many products available now. It's almost overwhelming the number of choices, but a lot of them are just sort of, they've rebranded, they've put a different face on the product that came from like human medicine. And that really doesn't always work in vet medicine. So, I mean, that's one of the things. You guys have built this from the ground up.
Yes, 100%. So I think one of the most important things and that's why I was trying to explain is how the AI was actually developed, right? So, but going back to your question about what kind of like problem does it solve for veterinarians? I want to say that I think the biggest problem, honestly, is that vets don't really receive enough education about dental X-ray interpretation in vet school. And I don't know about you, Dr. Ward, but I think I only got like 1 or maybe 2 lessons about dentistry during all the years in vet school. So it can be intimidating at times. And, dentistry is one of those areas where there is a steep learning curve and a lot of pathology is subtle and it's really easy to miss things. And I've been there taking dental radiographs and thought everything looked fine. And then you realize later something was actually going on. And you feel terrible because you are leaving a patient in pain potentially without realizing it. And that really that's the worst thing that you can do as a veterinarian. So what I really like about RapidRead is that it really reduces the risk of missing pathology. It acts as a second set of eyes or phone a friend dentist. It helps improve your confidence and decision making, and it really helps to standardize the quality of care, but making dentistry more accessible.
And the thing too, Dr. Herrera, is, I mean, this has been widely employed in human dentistry. One of my dear friends from high school and all through college, is a human dentist, and he was talking about this, 5 years ago, and he talked about how it completely transformed his practice. And he's a general dentist, and I, at that time, I was like, well, wow, that'd be cool if we had it, but we don't. And I mean, so you're building also on the backs of some of those advances, and I think one of the things that's interesting about AI applications in veterinary medicine, at least from my perspective and what I've witnessed the past few years, is we're kind of leapfrogging some of the human elements because we're learning what they worked on the last 5 or 6 years, right? And we're now saying, okay, so we learned all the bad stuff and now we're applying the good. But, talk to me a little bit more about though how you build these models, because like you had an image there of, a dental radiograph, and this is now identifying potential lesions. So how did you guys actually go about building that? And like, did you have thousands of images that you evaluated and, across the country or the world? How did that actually work?
Yeah, actually, this is a very important question because we are, basically the way that it was developed was that we looked at what are the most common findings in veterinary dentistry, and we start there, right? So, and then we look at cats and we look at dogs because they have very different pathologies, right? That we see on a daily basis on these patients. So, then we look at, thousands and thousands and thousands of studies and radiographs. And then we identified each pathology, and then we started the labeling. And and all this work is done by veterinary dentists and data scientists. And I think that's very, very important, because not every AI is created equal, right? So our AI has been trained by veterinary dentists and has been trained by on a tooth by tooth basis. So it doesn't look at just like one part of the image. It looks at the entire image, and then it provides the context and the understanding. So that's, going back to what I was saying about, deep learning and the transformers and all that. So that is what really makes this AI so unique and so different.
Yeah, and I'm glad you pointed that out, because that is really important, vertical vet family. The fact that this isn't done in isolation, it's not tooth by tooth. This is actually looking at the entire oral cavity, really. I mean, whatever you can image, and also your own input, which, don't forget, you can add notes to this system. And I think it's really important contextually, because, it's very easy to look at pathology on an individual tooth basis, but how it applies in the entire mouth is very different, so again, just having one problem here on this one tooth, and you miss, how does this all connect here? So especially I'm thinking stomatitis with cats and things like that. I mean, it's very easy, to sort of just focus on the individual tooth. But I do want to focus back on something you mentioned earlier. And I think, if you could just establish for the vet and veterinary technician who's watching, how does this actually work in the workflow? I mean, does this take a long time? Do you take x-rays and then have to upload them and then wait? I mean, how does the actual workflow of it go?
Yeah, and I'm so glad that you're asking this question, because this is really where I think it becomes really powerful, this tool. So I have a slide here to show. Perfect. So in a typical workflow, you start by anesthetizing the patient and taking your radiographs, and then start the probate cleaning. And then you have really three options for reviewing those dental x-rays, right? So first, you can send it out to a veterinary dentist as a stat to allow treatment planning during that same anesthesia. But really, this means an increased cost and can take up to an hour or more to get results, because remember that there are very few veterinary dentists available. Another option is to proceed with treatment without the benefit of getting a review. So you can take a look at the x-rays and do your best to interpret them, with the risk of providing either treatment that may not be appropriate or needed, or just missing some important pathology there, with the risk of leaving the patient in pain. And then the third option is to send it out. Send out the x-rays to a veterinary dentist as a standard consult, and have the patient recover from the anesthesia and plan treatment for another day, which means higher risk, because you need to anesthetize the patient twice, and it also increases the cost for the pet owner and time for you and the client that needs to come back again. So really, none of these scenarios are ideal. So what I want to show you is how the workflow looks like when you actually have RapidRead Dental, right? So if you look at this now, so in this case, you will anesthetize the patient and take the intraoral x-rays and submit them to RapidRead. Now, then, while your team is doing the cleaning and probing and charting, you get the report back before the procedure is done, so within 10 minutes or less. So you will then review the report and treat as needed. Right then, during the same anesthesia event, completing the treatment in one visit, and with the confidence of making the right decision. So I look at this as, instead of let's wake the patient up and maybe bring them back later, you're able to say, we have all the information now, let's make decisions and treat everything in one go.
And again, I just want to clarify, this is within minutes, right? I mean, this isn't waiting half an hour or two. I mean, this is single digit minutes in many cases.
That is right. Within 10 minutes, I mean, we say 10 minutes because, you never know with internet and stuff, but honestly, the most of the time, within 2-3 minutes, you get the report back.
Yeah, and that's really the feedback I've received from folks who have used it already, Chris, is the fact that they're saying, guys, it's almost like it's so fast. Like, I'm just getting started and then it's like, oh, the results are in, And that's
Right.
great also because not only, are we talking about not having to re-anesthetize and come back another day, but you're not also prolonging the anesthesia, waiting on results. And I think that's something that, if I'm a veterinarian out there evaluating tools like this, I have to, safety, always paramount. And so for me, it's like, okay, does this really work in the workflow that as I do it, or am I going to have to sit around and wait and kind of tick off the minutes as I watch the anesthesia and wait on the results? And that's just not the case anymore. It's remarkable. One thing I do want to kind of touch on too, we've talked with other good folks at Antech, over the past couple of years about the rapid read, and one of the things I think they did brilliantly, and really I wish everybody in the industry, especially in the AI technologies, would have done, is they said, what, we're not going to try to do everything. We're going to do what we can do exceptionally well. How did you apply that same philosophy and tenet to the RapidRead Dental?
Yeah. So the thing is that a lot of the times you will try to do too much, and and then it's so for us is more important to do what is the most important thing for in this case in dentistry, what are the most common findings, and what are the most the toughest one to find, or the most common ones to miss, right? So we really focus on those ones, and really until we have almost like 100%, you can never say 100%, but sure that that is actually happening, like that the AI is actually finding that finding in it correctly, we will not release it. So we have a huge team behind the scenes and labeling and making sure that whatever these standards are, we meet them, and we're never going to release a finding until we are very, very sure that the accuracy is where it needs to be. So we're very proud of the way that we're doing that. And again, like we may not have all the findings in the world, but they're coming. So we may be a little bit slower there, but you can be sure that the findings that we have are spot on.
And Dr. Herrera, you just said the most important thing. I've said it before, but I'm going to repeat it again for the vertical vet family. The fact is you've got to be very, very careful with who you select for these types of technologies. Artificial intelligence is not created equally, and I'm telling you, there are a lot of folks out there promising all kind of things that they just can't deliver on. And it's very hard for us as general practitioners to actually discriminate, like, what is it legit or not? And that leads me really to two questions I want to kind of combine into one. Number one, I mean, you've been working on this since the beginning. I mean, obviously this is something you're very passionate and very knowledgeable about, but what gives you confidence in the accuracy of the results? And then, okay, tell us about, how does it work if you see something that maybe the AI didn't see, or maybe the AI says there's something here and I don't agree with it. I mean, how does that kind of work? Because, a lot of veterinarians are seeing results. I mean, we see them with the AI scribes where suddenly it wrote down something, a different drug or a different diagnosis, and we have to go and correct it. But how does that work when it comes to imaging?
Yeah. So from my perspective, working in this product, what really gives me the confidence in the accuracy and the reliability is that the amount of clinical data and validation work that we went into building it. This wasn't developed from a small data set or a handful of curated cases. It was built using around 10 years of structured dental reports, and along with like tens of thousands of dental radiographs, as I was saying earlier. So, and very importantly, those images weren't just like fed into a system like blindly. Veterinary dentists were heavily involved in labeling, validating, and reviewing the findings throughout the development. So there is really a clinical foundation behind the technology. And what I really also really like is that the evaluation wasn't just done at the image level. It was assessed tooth by tooth and pathology by pathology. So, and that's important because dentistry is incredibly detailed. You need to know not just whether there is disease somewhere on the image, but which tooth is affected and what the specific concern is. And the other thing that is very important to us was maintaining high accuracy standards. So the system has strict thresholds for what it considers acceptable for analysis. So if an image is non-diagnostic, maybe, I don't know, because positioning isn't ideal or there isn't enough detail, then the system will exclude that image rather than provide unreliable information. And honestly, I think that is a strength and not a weakness. It shows the focus is on delivering clinically meaningful and reliable support rather than just forcing an answer on every image, regardless of quality.
And again, as I shared in some of the other Rapid Read webinars that we've held here at Vertical Vet, the stakes are really high for Antech, guys. I mean, this is not a fly-by-night company. This is not a company that doesn't have a lot on the line. And so they only get it right. And I will say, once again, Dr. Herrera, I was so impressed with the slow and gradual rollout of AI technologies. I mean, going back to SDMA and some of the, renal tech. And so I will say that you really do, if you're out there like me and you're a practice owner, you're a manager, you're a veterinary technician, a veterinarian, you need to buy the seller. This is a situation where you're buying Antech's reputation, deep wealth of expertise and experience and, experts. And that's what you're actually latching onto, in my opinion. But again, getting back to that from a workflow perspective, let's say that you see something, the AI flags something, and you don't know if it's right or wrong. What do you do? How do you call somebody? Do you email somebody? Like, what's the actual process?
Yeah, so I love this question because I think clinical judgment matter most in the interpretation and decision making side of the process. I mean, it's very important to understand that AI does not make a diagnosis, right? It's a decision supporting tool. So we as doctors still need to use our doctor brain and in reviewing the radiographs and performing the clinical exam and evaluating the dental charting and ultimately deciding on the diagnosis and treatment plan for that tooth. So really the value comes from combining all those pieces of information together and not relying on any single one in isolation. So honestly, one of the best use cases is actually when you don't agree with the AI. And you may say, well, what are you saying, Criss? Well, I say that because that is where some of the biggest value, clinical value happens. If there is a discrepancy, it pushes you to pause and double check. Right? So, like, did I miss something on the radiograph? Is there something on charting or clinical exam that supports this finding? Or is this something that's not clinically relevant in this patient, right? So either way, you're making a more informed decision. And sometimes you may review the patient again and realize the AI highlighted something subtle that deserves attention. And other times, you may confidently reject the finding based on the full clinical picture. And that's completely appropriate too. So the goal isn't for the veterinarian to blindly follow the report. The goal is to reduce the chance of mispathology and support better clinical decision making.
Yeah, I couldn't agree more. It is so important, guys. I mean, this is an extra set of eyes. More importantly, it's like an extra set of 10,000 eyes, to be honest with you. But it just gives you that additional security and confidence, And again, it may flag something that you completely disagree with. And I'll tell you, Criss, I actually had an experience like this last year with my own personal dentist, and he uses a similar technology. They do well. And he said, look, there is an area that I want to let you know. There's an area that the AI is flagging as potentially a problem. I've examined your teeth, and right now I'm going to just take a watch and wait attitude toward it. I don't see enough evidence for me to intervene. And and it was brilliant. And I'll tell you what, on the follow-up this last time that I just went, he flagged it again, and he said, look, I haven't seen any progress in this lesion, but the AI is continuing to notice it. So it's something we're just going to, and I love that, right? And actually, as a patient, it gave me another level of confidence, right? Like, I felt so assured that my dentist was doing absolutely everything in his power, including leveraging technology to make sure that my mouth was healthy. And for the record, guys, if you've seen me lecture, you know how much I dislike going to the dentist, so it was a big deal. Now, one of the things too that my dentist, my friend who's a dentist, and I think a lot of folks that are watching this, it's the client communication part, right? Because this guy gives me a report, it's on there, hey, there's this tooth and watch this thing. And talk to us a little bit about how we can actually leverage AI and these reports to do a better job, communicating and educating our clients.
Yeah, so this is honestly one of the most underrated benefits because explaining dental disease to clients can be tough. And I'm sure, Dr. Ernie, you've been in a situation before where you were in the middle of a dental and had to call a pet owner and explain them that their lovely dog Fluffy needs like 15 teeth removed. And I mean, who hasn't been there, right? And I mean, that's not a funny conversation to have. But when you show them a visual report where each image is labeled with a color-coded tooth number indicating the severity of pathology identified, they see a lot of red, yellow, that brings attention and provides clear evidence. It really completely changes the conversation. Instead of, oh, we think this tooth may be a problem, it becomes, here is exactly what we're seeing and why we recommend treatment. So it helps justify procedures, yearly dental radiographs to monitor the remaining teeth, costs, and that really builds trust, improves treatment and acceptance, right? So this is why all these teeth need to come out. Improves client compliance for scheduling yearly dental procedures. They want to really know what's happening with those teeth that were flagged, and it really enables that year over year comparisons.
And Dr. Herrera, that report that you're showing right now on the screen looks very similar to the report that my dentist, and I'm sure a lot of folks, in Vertical Vet that are watching this, they've probably started to see similar reports. And you're right, it just facilitates the whole conversation. It sort of gives additional value, but more importantly, it sort of validates why you're saying we either have to extract or watch or do whatever.
100%. Yeah, it's just like it's so much easier to have that conversation. Honestly, I feel like once you start using it, you can't go back.
Well, I do want to ask you, I mean, again, you've been one of those sort of pioneers in this space for Antech. I mean, did anything surprise you as you were sort of on this journey? I mean, I know I've talked to a lot of the folks on the radiology side, and, they found some things that they didn't, I mean, there were a couple of lesions and things that they didn't expect the AI to actually be really good at. Any of those kind of little, unexpected, little bumps and surprises?
Yeah, I honestly, I think what surprised me most is how often things get missed, even by experienced clinicians. And that's not a criticism, it's just a reality. The dentistry training provided in vet school, it's very limited, and we're busy. Like, we're multitasking, and dental radiographs are complex. So seeing how much of a difference a second layer of review can make, that really stood out to me. Like, how it forces you to look twice at an image, second guess yourself, and how much you learn because you initially didn't pay attention to something that suddenly you see because RapidRead is pointing it for you. So yeah, I think that's the biggest surprise.
Yeah, and I love the fact that, it's a learning tool. Like, I've been amazed at just looking at AI radiographs, and it's highlighting and identifying things that maybe I ignored or just sort of undervalued, and suddenly you go, oh, I need to take a second look, like you said, and I've done a lot of online searches saying, wait, what? How did I not know this? And it's really been a great tool to sort of advance my own abilities with reading radiographs. And I would imagine, again, as we move forward with RapidRead Dental Tech, this is just going to be the same type of story. I love that.
Yes, yeah, 100%. And we're, as I said before, like, we're constantly developing new findings. So we're working on the next set. So yeah, we're very excited about what's to come.
Okay, so right now we've got a veterinarian, a practice owner, a practice manager, a credentialed veterinary technician. They're watching, they're going, this sounds great, Ernie and Criss, but I don't know, it's going to be too difficult to do. I don't know if my clients will pay for it. I mean, what advice can you give that person watching today that says, hey, look, give them that nudge to say, try it at least?
So I think position the tool positioning as a tool to improve workflow efficiency and client communication and treatment acceptance. Because, I mean, you're going to be able to make more informed decisions while the patient is still under anesthesia and visually show the clients what's happening. So, again, like going back to that patient lying on the dental table and having to make that call to the pet owner and explain, you have a tool that can make your life easier. I mean, why not use it, right? So it's going to help you catch more pathology, feel more confident, and engage the client in the pet's dental health and help prevent disease.
Yeah, and again, I still am baffled by some of my colleagues, Dr. Herrera, and I'm sure you've heard the same thing. This isn't replacing us. This is augmenting and assisting us, and it's amplifying our abilities. Like, I just don't see this as a threat. I only see it as an asset moving forward. Now, obviously, if Antech starts coming out with robots dressed in white coats, then we might have a different discussion. But I think this is just going to make me a better clinician, especially in these areas like radiology, like dental imaging, that I'm going to be honest, guys, I'm not as good as I would like to be. And a lot of it has to do with, like you said, we weren't taught a lot of this stuff. And then experience-wise, it's sort of one of those things where we just don't do it constantly enough to get that expertise that we kind of crave. And I think this is just, again, I think it's not only a client communication, not only a business builder, but I think it's an educational tool for vets.
Oh, 100%. And yet, to your point, like to me, I don't see AI as a threat at all. Like, it's just it's a tool to help me do a better job and to make sure that, again, like the whole point of this is like make sure that we're not missing pathology, that we're not leaving a patient in pain, right? So if I can do that, if I can just have another second set of eyes to make sure everything looks fine, and if that's going to help me having that conversation with the customer, I'm like, all in.
Gosh, I got to tell you, I've loved this conversation, Dr. Herrera. Dr. Criss Herrera from Antech Imaging, again, talking to us about amazing applications, AI in dentistry. Criss, thanks again for spending time with us.
Yeah, no, thank you so much, Dr. Ward, for having me today. I really, really enjoyed the conversation and hope many vertical vet clinics give RapidRead Dental a go. I think it's a game changer and they will love it.
Yeah, thank you so much. Well, guys, that's it for another edition of Vet Med School. And again, we partner with companies. We're selective about who we partner with. And Antech, of course, is one of those partners that we trust to bring us technologies like this that can, again, elevate our practices. So if you want to learn more, you can reach out to us directly. We've got a wonderful team of really talented folks who can help guide you and get you in touch with the folks you need to see. Obviously, being a member of Vertical Vet means you get some perks and special stuff, being that, we're partnered with Antech. And this is one of those areas where, just like with the radiology, the RapidRead technology, this is one of those, you owe it to yourself and your patients to actually schedule a demo, talk to some folks, and see how it can enhance your clinical abilities. Because guys, this is changing so rapidly. It is helping us in so many ways. I am so excited. It's kind of one of those things where, even though I've been in this profession a long time, I am actually so enthusiastic and optimistic for the future. I just can't stand it. And again, I want to thank Antech for continuing to innovate and develop this type of tool that makes me a better veterinarian. Well, on behalf of the entire amazing, outstanding team at Vertical Vet, I want to thank you again. I am Dr. Ernie Ward, Chief Veterinary Officer for Vertical Vet. We will talk to you next time. Bye.